Hello. In the last few weeks, I have had the opportunity to explain the three levels and the three phases of the cognitive conceptualization diagram. More specifically, the trial-based cognitive therapy conceptualization diagram. Regarding the first level, I talked about automatic thoughts and how they generate emotions, behaviors, and physiological reactions. It is clear that emotions, behaviors, and physiological reactions depend on how we perceive the events or situations. This is why we call them automatic thoughts, since they pop up into our minds spontaneously without our control. Automatic thoughts may be correct, but may be distorted or may be only partially correct, which involves some level of cognitive error. This is why it is important for us to give patients the notion of what cognitive distortions are, to teach them how to identify and name them, and finally, to teach them how distortions can be modified and corrected. Better yet, we can inform patients that they can be informed about the frequency and the intensity of the cognitive distortions that they made during the week. For this, I developed a questionnaire that I call Cognitive Distortions Questionnaire, or CDQuest. My plan here is to speak in the coming weeks about the techniques we use to monitor and change cognitive distortions. The CDQuest, which I developed a few years ago, is a questionnaire that I ask patients to fill out weekly. However, when this is not possible, I ask the patient to fill it in as often as possible. What we have then is a global score that will give us the notion not only of the frequency they occur, but also of the intensity, that is, how much the patient believes in such thoughts. As the therapy progresses, the patient perceives the scores being reduced along with the symptoms of depression and anxiety. This means that the frequency and/or intensity of the credit given to such distorted thoughts is diminishing. We have two versions of the CDQuest, one for research and one that is fundamentally clinical. That is, the patient can bring examples of the distortions he made during the week. The interesting thing is that the patient filling in the questionnaire weekly, or at least frequently, is not allowed to forget what he or she learned about the distortions or cognitive errors throughout the therapy. He or she will always be reminded of cognitive distortions like catastrophizing, mind reading, select abstraction, etc., which increases his chance of correcting them. The CDQuest has already been validated in Portuguese, English in the United States and Australia, and in Turkey. In addition, the CDQuest is being validated in other countries and languages such as France, China, Iran, Pakistan, etc. I would like to take this opportunity to inform that I am offering courses on trial-based cognitive therapy online. The most recent one that I have announced is the weekly 2-hour meeting involving theory and practice of TBCT. The link for more information appears on this screen. Please just visit our website and get to know the courses that we are making available online. If you liked this video, please give it a thumbs up. You can also refer it to your friends and colleagues. If you have not yet subscribed to this channel, please do so now, as you will receive notifications whenever new videos become available. See you next week.